All right, good morning, everyone. I'm going to do my best to talk here. I'm getting over a cold that everyone's seen making its way through the community, so there may be a little throat clearing over the microphone here. So my name is Brian Taschner. I'm a cardiologist with Lee Memorial. So a few years ago, I also got involved in the food as medicine concept. I started to become a little bit frustrated with seeing my patients come back each year or every 6 months. They weigh a little bit more. They're on some more medicines. They actually feel worse. They're spending more money on medications. So I felt like I was doing something wrong. I was following the guidelines, but I was making strides backwards rather than forward. And what I realized is that I really wasn't attacking the root of the problem, which is actually the process of coronary disease and the process of hypertension. We're just treating it with Band-Aids. So the more I read, I realized that food has really a critical role in preventing the development and the progression of a lot of the processes I see and treat every day. All right, so why is this such an important topic, cardiovascular disease? We know, and this is data from 2012, 2013. It's really not changed much over the years, and on the top here you can see that coronary artery disease is the #1 cause of death in our country, and not far behind is stroke. So when we combine that as cardiovascular disease, those are by far the most common causes of death in our country. Cancer is the #2 cause, and I'm really not going to spend a lot of time talking about food and cancer today, but there is a lot of data out there looking at the associations of food and cancer. And I'll point out a couple of items in some of the studies I'm reviewing where they talk about reduction in cancer with food. And I'd like this chart over on your right side here, where one of the reasons cardiovascular disease is so prevalent is what we put in our bodies. So we eat too much fat, too much cholesterol, too many processed foods. These can contribute directly to cardiovascular disease and also to things like diabetes and obesity, which we know are major risk factors. And this is a chart of our country and the rates of obesity. And you can see that, and it's very interesting if you look back 20 years at similar maps, the obesity prevalence was much, much less 20 years ago. So when you walk through the years, and sometimes Jim Nathan has done presentations where he's walked through 20 or 25 years, and you can see how much it's increased. But it's clear that many of the states in our country have almost a third prevalence obesity rate, and another third are overweight. So we can see that this has become an increasingly epidemic problem. And I just wanted to touch a little bit just on the pathophysiology of coronary disease. So when we talk a little bit about how food impacts that, you have a little bit of an idea of what I'm talking about. So this is actually a picture of a blood vessel, and it's cut in half. So we see the inner lining of the blood vessel here. It's typically made up of 3 layers. The inner layer called the endothelium. So the inner layer here is what we call the endothelium, and that's not just an inner lining. It's actually an active organ, and it produces things like nitric oxide. Nitric oxide is something that helps our blood vessels dilate and prevents platelets from getting sticky. It prevents inflammation. So when that's damaged, that inner lining isn't working well, and we get the vessels, they start to constrict. They don't dilate appropriately with stress. And we start getting more platelet stickiness, and these things are all things that lead to heart attacks and strokes. And how does that endothelium get damaged? It's by a lot of the risk factors, the high cholesterol, the oxidized bad cholesterol, blood pressure, diabetes, and some of the food we eat. So when we're born, this is a nice smooth layer, and at a very young age we start to get some, particularly with our lifestyle here, we start to get some cholesterol deposits that actually make their way under this superficial layer, and this plaque starts to build over time. And once we see people have narrowing in their carotid arteries, narrowing in their coronary arteries, they start to have symptoms of chest pain. It's when this blockage reaches a certain threshold. And when people come in with a heart attack, this becomes unstable. It becomes inflamed, unstable, it ruptures. All this blood starts to clot on here, and they have an abrupt closure of the vessel. So what we really want to aim to do is stop this process early on or catch it here and reverse it. Many of my patients are already at this level, and they've had stents and bypass surgery, but we can really reduce the recurrence of further events by using food. Right now, what we're doing is things like statin medications and blood pressure medicines and blood thinners, and those do have a role. They've reduced the risk of heart events almost 2/3 by about 60%, but there's still quite a large residual risk. So the question is, can we actually reverse coronary disease, and can we prevent progression? Can this be accomplished by using food? And as I mentioned, the medications that we use, they treat the certain risk factors and they have some efficacy, but they come with a cost, they come with side effects, which we hear about all the time. Stents and bypass surgery, they're really there to relieve symptoms. Again, they don't address the underlying problem. So is there a role for diet? And today I'm going to talk to you a bit about the whole foods plant-based diet and some of the data that's out there that shows indeed there is a role to plant-based diet in reversing coronary disease, preventing coronary disease, and improving outcomes. So before we get started with the meat talk, I just wanted to show two charts that I actually took from the China study, a book by Colin Campbell. So that two of the things that we consume too much of here are processed foods, refined foods, and too large quantities of animal proteins. And you can see here there's a clear correlation. This is a chart, if you look on the bottom, this is the percent of total calories coming from animal protein, that's on the bottom. And this is a risk of cardiovascular death. And you can see that there's a pretty good linear correlation. The higher the consumption of animal protein, the higher the rate of cardiovascular death. And this one you can look at the white bars as you go down this way from left to right. That's the percentage of deaths from heart disease and cancer. And you can see the U.S. is right up near the top there. And the dark bars are the amount of good plant-based foods. So as the amount of plant-based foods increases, the rates of coronary disease and cancer deaths decreases. So right away, those are two pretty impactful charts that we'll use to start the meat of the talk here. So how I've organized the presentation, I'm going to go over a few larger, what we call cohort or population studies that look at population data and the effects of diet and lifestyle on cardiovascular disease, and then I'll review a few smaller trials that were randomized trials, really trying to expand and further explore the concepts that were identified in those larger trials. Has everyone heard of the China study? I know Colin Campbell was just here about a week ago. So the China study was an idea that began initially in the 1970s after something called the Chinese Cancer Atlas. And the premier of China at the time was stricken with cancer, and he wanted to investigate further the role of perhaps some environmental influences on the development of cancer, because there wasn't much known at the time. So the majority of citizens in China were actually involved in this study at the time. And they concluded that, yes, there was some geographic localization. So in different parts, different kinds of cancer were more prevalent, suggesting that there was some environmental influence. So the China study was actually, it was a collaborative effort between Oxford, Cornell, and then this Chinese Academy of Sciences to investigate this concept further. Could they find what specific dietary and environmental influences affected the rate of cancer? And they actually added cardiovascular disease as well. So there were a lot of endpoints they looked at, and there were about 6,500 people, 65 different counties in China. Ultimately, they did demonstrate, one of the things they demonstrated, among many other, was there was an association, or there appeared to be an association between animal protein consumption and various forms of cancer and cardiovascular disease. Just to stray for a moment, this is a chart that also taken from the China study where he points out that the difference at the time in the typical Chinese and the American diet. You can see that they actually consumed more calories in China, mostly because they were more active. They're a more active population. Especially at the time, there was a lot more farming. The fat calories were actually quite a bit less, especially the saturated fat calories. There was a much greater percentage of fiber. They consumed about 2/3 the amount of protein that we did, and the majority of that was based in plant-based forms of protein rather than animal protein. So that's one of the things that I'll continue to refer back to, is the plant-based diets tend to have a much lower percentage of animal fats, obviously, a lot more fiber, minerals, nutrients, micronutrients, phytochemicals, all of those things. And those are all felt to play a role in the benefit. When they looked at some of the final data, they really grouped the diseases really into what they call diseases of affluence, which are more the things we see in Western society, so cancer, diabetes, cardiovascular disease, and then diseases of poverty, which are mostly infection and malnutrition. And it was really the diseases of affluence that were tied more to animal protein consumption. In fact, the strongest association with these diseases was the total cholesterol levels. And looking at the total cholesterol levels in China, they ranged from 90 to 170. And here in our country, 170 for total cholesterol is traditionally considered pretty good. If you look at the numbers, people say, well, aim for a total cholesterol of less than 200. So their higher number, 170, was equivalent to our lower number. And you can see a difference in the average cholesterol theirs was almost half, 127 versus 215. And they also found that a total cholesterol below 150 was really associated with an almost complete absence of cardiovascular disease. And this is a theme that I'll point out again. When we look at things like the Framingham Heart Study, they confirmed this same number. They discussed in some of their papers how they've never seen any cardiovascular disease in patients with a total cholesterol of less than 150, and even some studies by Dr. ESSELSTYN, which I'll refer to. Overall, the coronary disease death rate was 17 times lower in China than it was in our country, so that's a pretty profound number. The second group of studies was something called the Adventist health studies. There were actually 5 of these. It's another large population cohort trial. I'm only going to talk about numbers 1 and number 2. So these are all long-term medical research projects of Loma Linda University, and I'll talk on the next slide a little bit about the Seventh-day Adventists. The reason why this group is a very good group to study epidemiologically is they have a very homogeneous lifestyle, very clean lifestyle, but they do vary a bit in their diets. The lifestyle promotes vegetarianism, though. So this is a Protestant denomination, mostly focused in Loma Linda, California. They run a lot of nonprofit hospitals. And because of this population, this unique population I talked about, the NIH has sponsored different population research projects with them. And they've shown on average that the average Adventist in California lives 4 to 10 years longer than the average Californian. And you can see there they recommend vegetarianism, discourage alcohol, tobacco, caffeinated beverages, and about 1/3 of them are vegan. So again, they really promote a very clean lifestyle, so you take some of these other confounding factors out, and you're really focusing on the different food divisions, which are the vegans, and they have vegetarians, pesco-vegetarians, semi-vegetarians, and we'll see some of those in these 2 trials. So the first trial, the Adventist Health Study 1, was done in 1970s and 1980s, about 34,000 people, and it was really used to determine what components of lifestyle had an influence on initially cancer, but later cardiovascular disease as well. And they really found that there were 5 behaviors that were associated with better or worse outcomes. So the better outcomes were associated with not smoking, eating a plant-based diet, eating nuts, exercising regularly, and maintaining a normal body weight. And if my patients could hit even 2 of those, I'd probably be pretty happy. In some of the specific numbers, they show that eating nuts, and I'll talk about this a little bit later in the talk as well, reduce the risk of heart attacks by about 50%. And when they look at this, it's not just eating a couple a day or not. They looked at different quartiles or tertiles, so the people that ate the most, or 5 days a week versus 1 or 2 days a week, had a linear relationship with a lower association with cardiovascular disease. They also found that switching from white breads or refined grains to whole grains reduced the risk of myocardial infarction by 45%, and there was an overall reduced all-cause mortality with a vegetarian compared with non-vegetarian diet. So this is not a vegan diet, but it was a vegetarian versus non-vegetarian. So the second Adventist Health Study actually expanded on this a little bit more. This delved a little bit deeper into the association between the vegetarian diet and lifestyle and cardiovascular disease. It was a larger trial, almost 3 times as big. There were 96,000 that were initially recruited, 73,000 that were included in the data. And they divided groups more specifically into non-vegetarians, so almost 50%. Semi-vegetarians, and they define that by eating animal protein a certain number of times a month, or less than a certain number of times a month. There's pesco-vegetarians that ate fish, but no meat. The lacto-ovo-vegetarians, which consumed dairy products and eggs, which were almost a third, and then the vegans, which made up a smaller percentage. So this trial demonstrated not only a reduced all-cause mortality, but also cause-specific mortality, so specific reductions in cancer and cardiovascular disease. And interestingly, associations were greater in men than in women. So we can look at this chart here. So I know these little charts always have a lot of data, but what I wanted to point out was this is the death rate per 1,000 person years, and these are the different categories of vegetarian or vegan diets versus non-vegetarian. So the death rate was less for all categories compared to non-vegetarian diets. And then this is a chart just showing, and I just wanted you to focus on this little area I highlighted. When we look at ischemic heart disease and cardiovascular disease deaths, there was about anywhere from a 15 to 20% reduction overall. In men, this was closer to 30%. And in women, it was a little bit less profound, up to 12% here, not much of a difference in just the cardiovascular disease category. And when we divide these into each of these subsets of disease, I'll just point out a couple of things. So when you look at male vegans, there was about a 25% reduction in death. The vegan group wasn't actually, as the numbers weren't as profound in females. The pesco-vegetarians actually did very good in the female group. But again, compared to non-vegetarians, these people tend to eat a lot more of a plant-based diet, which is really what we're encouraging. We can see that consistently the numbers were much better in these groups than in the non-vegetarians. We did talk early on about just weight and diabetes being major risk factors, and you could see here that in the non-vegetarian diets in the red compared to different categories of vegetarian, and this is the vegan diet in the blue here, both the body mass index and prevalence of diabetes was significantly decreased in all of those groups. And then the last population study I'll mention is something called the EPIC Oxford study. The EPIC study is a large cohort study in Europe. The Oxford component of it was people from Scotland and England. There were about 50,000 people or so in this group. 34% of them were vegetarian. And once again, they found a 32% lower risk of ischemic heart disease in vegetarians compared to non-vegetarians. And this was after adjusting for many other risk factors. Like we saw in some of the other cohort studies, there was a lower incidence, or excuse me, lower levels of blood pressure and cholesterol, which were felt to be the main contributing factors, and also lower body mass index and diabetes, as we just saw in the Adventist health study too. So I think with all these large population, these cohort trials, we saw similar findings that eating more of a plant-based diet consistently in these large populations led to lower levels of cardiovascular disease, so heart disease and stroke. We were consistently seeing less obesity, which we see has been growing in our country, and less diabetes, which has also been growing in our country, and both really wreak havoc on our systems. So that I'm going to talk now about just a couple of the smaller trials that use these same concept but looked more in a prospective fashion. So they actually took patients and randomized them to a standard diet versus a plant-based diet and looked at some different outcomes. So most people know who Dean Ornish is. He's, again, one of the founders of this plant-based movement, if you will. He's the founder of the Preventative Medicine Research Institute. Really has always had a focus on not only food, but lifestyle and the effects of lifestyle on disease, especially cardiovascular disease. He conducted something called the Lifestyle Heart Trial. So this was a trial to look at whether ambulatory patients could be motivated to sustain to make and sustain comprehensive lifestyle changes. So that's one of the big challenges we face all the time, is having people transition what they do day to day to a more plant-based diet. Especially in our practice, we don't have a lot of time to talk about nutrition. But not only can those people make that change, but can they sustain it? And I think anytime we talk about diets, and I don't look at the plant-based eating as a diet, but whenever we talk about some way of eating to get more healthy, it's hard to sustain that. So in the people that were able to sustain it, they were looking to see whether or not we could stop or reverse the progression of coronary disease. And he was trying to do this without using any lipid-lowering medications. The initial plan was to follow these patients for 1 year, but because the outcomes were so favorable at that time, they extended the study up to 5 years. And one of the plans for this trial as well was really to look and look specifically at regression of coronary disease by doing heart catheterizations or angiograms. So these people, the intent was to have everyone have a baseline angiogram, have it at 1 year, and have it at 5 years. And not everyone did all 3 of those, but they had quite a few that did 1 in 5 years, and I think those are the most important endpoints to look at. So you can see this trial was over 5-6 years, involved just under 50 patients. 35 completed the follow-up 5-year angiogram. So there were 28 patients that ended up being in the experimental group, so the more intense lifestyle change group, and 20 were in a control group, which even these people weren't necessarily eating just the standard American diet, but recommended American Heart Association type diet by their physician. The intensive or the experimental group with intensive lifestyle changes, you could see, had a diet composed of 10% fat, whole foods, vegetarian diet. They had to exercise a certain number of days a week, stress management courses every day. So again, he was looking at the whole lifestyle approach. He actually, unlike what we'll see with Dr. ESSELSTYN, did allow having a cup of dairy a day, so either yogurt or milk and some egg whites. Other than that, it was more or less a vegan type diet. So the clinical outcomes were pretty impressive. We could see that in both groups, patients were able to sustain 5-year follow-up, so 71% versus 75%, demonstrating that indeed people could make the change and sustain a change if they had the appropriate support to do so. We saw that there was a 72% reduction in angina at 5 years in the experimental group compared to the control group, where they had a 36% decrease. And interestingly, at the first year, angina or chest pain related to blockage was reduced 91% versus 165% increase in the standard group. And the reason that we saw those 2 numbers come together at 5 years was the number of the people who had chest pains at the 1 year went on to have stents or angioplasty. So we relieved their symptoms, but we relieved them mechanically rather than just with food. And when we look at the overall outcomes, you can see that, and this was a small trial, so it's hard to get a lot of great statistics out of this, but you can see that there were lower rates of heart attacks. It says percutaneous angioplasty, so that's a stent or a balloon, bypass surgery, and cardiac hospitalization. So when you look at the N numbers, there were only 25 events that occurred in 28 experimental patients and 45 events in 20 control patients. And that was a statistically significant difference. So those numbers were impressive given the small size of the group to actually come up with a statistically significant conclusion. This is a graph of just the angiogram. So what we see here is this is the control group, and we actually see that there was from baseline 1 year, 5 years, there was an increase in the degree of stenosis or narrowing of the arteries, and in the experimental group, we could see that there was actually a reduction just with food. These people were not on any cholesterol medicines, of about 7%. And when you talk about reducing 7 or 8% narrowing, you look at the diameter of the vessel, it actually translates to a larger reduction in the diameter. So, and this was not just, even though there were 48 patients assessed here, they actually assessed almost 200 different coronary lesions, so multiple lesions in each patient. Overall, we saw almost a 40% reduction in LDL cholesterol at 1 year versus a 6% decrease in the standard American Heart Association diet, so much lower reduction in LDL cholesterol. At 5 years, they were both about a 20% reduction, but 60% of the control group was on lipid-lowering medications at that time. And still none of the experimental group took lipid-lowering medications. There was nearly a 13-pound weight loss at 5 years versus no change, and no real change in some of the other blood parameters, the triglycerides and HDL. And Dr. Caldwell ESSELSTYN, so I always love his story. So he's another guy, he was a physician, and still is a physician, and he was actually an Olympian, Olympic rowing champion. So he has an interesting perspective from an elite athlete and a plant-based diet. So he was a general surgeon at the Cleveland Clinic, and one day he became very disgruntled with the status quo and disenchanted with how sick patients were getting, and he was operating on people that were getting sick. And very similar to how I feel, he felt like we were not really treating the underlying cause of the problem. And he himself, he talks about in his book how he changed from a plant-based diet. His story was interesting, how he one day had this very bloody piece of prime rib put in him, and it was in front of him. He said, "What am I doing eating this stuff?" And he kind of made an abrupt change. He said at that point he never ate animal protein again. So what was interesting was he really felt that a plant-based diet had significant health benefits, and he approached some of the cardiologists and the cardiovascular surgeons at the Cleveland Clinic and wanted to include some of these patients in his program. And as Sebastian mentioned, a lot of these guys were like, that has no role in treatment of our patients of cardiovascular disease. So, initially he was unsuccessful at having any of these people in his trials, but ultimately the surgeon and the cardiologist found some patients that were so sick that they had nothing left to do with them. They couldn't put any more stents in them. They couldn't do any more bypass surgery. These were people that were having chest pain walking across the room, or such bad leg pain from peripheral vascular disease they couldn't walk more than 10 feet. He talks about a lot of these patients individually in his book where they couldn't even walk to his office without stopping multiple times. So it was these people that the surgeons and the cardiologists said, okay, you can take these guys and see how you do with them, because they were essentially given a prescription to go home and die. So this was his original cohort. This was back in 1985, and there were initially 23 patients. He ended up following 18 of the patients for over a decade. Now again, these patients had very good support. He met with them every 2 weeks for 5 years. They participated in group meetings, phone calls, and that's one of the things that as a system or as a society we really don't have those systems in place, and that's what we really need to change. As much as I talk about it or these guys talk about food, unless they have some consistent follow-up and some accountability and some support, we're not going to be able to change a lot of them long term. So his diet was a little bit more strict. He's the most strict of any of these guys. He allows for no oils, no fat, so even avocados and nuts. His goal was to get their cholesterol to less than 150, and if they needed statins or other lipid-lowering therapy in addition to diet, they were allowed to take them. So the average cholesterol in his cohort went from 266 to 132. That's a pretty impressive drop. And this is one of the statistics I find most impressive. So in the 8 years leading up to his study in these patients, there were 49 events: angina, heart attacks, angioplasty, strokes. Over the next 11 years, there was only one event. And in that patient, he had been off of the diet for a couple of years. So those are pretty astounding numbers. 11 patients had follow-up angiograms, and much like we saw in Dean Ornish's study, there was a roughly 7% improvement in the diameter, and some patients showed a near complete resolution of blockage. So this is actually this is published in his book. You can see that this is what we call the left anterior descending artery. It looks okay here, but as you get down to the bottom part of it, it looks very diseased. Not a lot of good blood flow there. And then this is 3 years later, 1996, 1999. You can see that really it looks almost like a normal vessel here. And so, and I believe this person was, guy was not even on cholesterol-lowering medication. So this was just diet alone. So much more impressive than what we see with what we're doing day to day with our medications. And this is another person just after 3 weeks. So this is what we call a nuclear medicine scan, a nuclear stress test. So what we see here, this is taking the heart and cutting it like a loaf of bread. So this is one slice of the heart, and you can see that this should be a circle. Part of this is missing here. This is an area where there's a blockage, so the artery is not supplying enough blood to the heart muscle, so the heart muscle doesn't light up with a nuclear medicine isotope. 3 weeks later, with no stents, no changes in medicine, you can see that there's pretty normal blood flow. The red would be considered completely normal. The yellow's not far behind. So a significant improvement with diet just in a few weeks. And a lot of that has to do not with reversing the plaque, but improving the vessel's ability to make this nitric oxide again, which we said can dilate the blood vessel and reduce the platelet stickiness, reduce the inflammation. So Dr. ESSELSTYN, this was a very small group of patients. He took this concept and much like Dr. Ornish, made a study, more of a randomized prospective study. Now these again were motivated patients who were wanting to make a change. They had good support. This study was done again to look at plant-based nutrition to see if we could make a difference in cardiovascular disease. It involved almost 200 patients. They received counseling, and his diet, as I mentioned before, really had all fruits, vegetables, grains, legumes, really no oils, avocados, no animal protein of any kind, nuts, sugars, anything like that. He did not have a requirement for exercise and meditation, although those things were encouraged. So of the 198, there were it was about 3 to 4 years, there were 21 of them that were not able to stick to the diet. Of those, 13 of the 21, so 64%, had adverse cardiovascular events: sudden death, heart transplant, stroke, stents, bypass, and carotid endarterectomy, where we had to clean out the carotid artery. In the 177 patients that stuck to the diet, there was only one event, which was a stroke related to disease progression. There were a total of 18 events, and he kind of goes through these in the paper, which were not felt to be related to disease progression. I mean, some people died of pneumonias, blood clots in their lungs. A couple of people did have bypass surgery and it was mostly because they had bad heart valves and they had to get their vessels fixed in that setting. But his point was, well, even if you said all of these 18 events were related to progression of disease, it's still only 10%, which is much less than the 64% that we saw in the other group, or the 62% that's typically reported in the literature. So that, again, is a very significant reduction. Other outcomes, most people had improvement in their angina or claudication symptoms, disease reversal. So not everyone had an angiogram here, but they did document reversal in patients that did have an angiogram. There were 27 people who initially were advised to have a stent or bypass surgery who were able to avoid those. And the average weight loss was almost 20 pounds. So the conclusions of his study were that that people are really willing, if they're willing to make a change, they have good support, that they also feel enabled that they can take control of their own disease, which I think a lot of people are lacking that I see day to day. And it's a more supportive evidence in a randomized trial that diet can really have a positive influence on cardiovascular disease. And I think I taught, this was just to compare and contrast the two studies. They were really pretty similar. This was Dr. Ornish and Dr. ESSELSTYN. Again, one included exercise and yoga. Ornish included some egg whites and dairy, low-fat dairy, just in limited quantities. And ESSELSTYN's was a little bit more strict in terms of eliminating a lot of the fats and oils. In the end, they had very similar outcomes, though. And the alcohol, by the way, I get a lot of questions about alcohol, and it is on here that it's allowed. You're allowed to have that in limited quantities. It's one of the most popular questions. Alcohol and coffee. So that was really the trials I wanted to review. Now I just wanted to focus a little bit just on, so we're talking about maybe eating less of certain things and eating more of other things. So in our country, we really don't eat many fruits and vegetables as a whole. It's about 5 to 10% of our calories or less are actually fruits and vegetables, and most of the vegetables are potatoes, and a lot of those are fried. So those don't really count. And so what we're missing out on when we're not eating a lot of these fruits and vegetables are a lot of the micronutrients, the phytochemicals. So these are things that a lot of the supplement companies try to package in pills, like resveratrol. I always have patients that have all these supplements, but I like how these guys really explain it. It's hard to package these into pills. So how they describe it is they say, well, a lot of these micronutrients, these phytochemicals, they're like a single violin player in a symphony. So if that guy might play beautiful music, but he's going to play much better music as part of this huge symphony. And that's how these work in our body. We don't know that, is it resveratrol that provides such great health benefits, or is it just drinking red wine or eating grapes? It's maybe how it works in the setting of a whole food rather than just that component. If you look at, this was a chart by Dr. Colin Campbell, and he just wanted to give an example of the difference between plant-based food and an animal-based. So this was a plant-based meal and an animal-based meal. They had equal amounts of protein. So both had about 33 grams of protein, but you can see that the more animal-based diet had much higher levels of cholesterol, total fat, and many fewer vitamins, minerals, and micronutrients. So my point was really to show that we're really lacking in a lot. This is all the good stuff you get from a plant-based meal, where you're lacking a lot of that if you're just eating animal protein. So to talk about some things specifically, fruits and vegetables. This was a study from the University College of London in England, and basically what they showed here was they looked at the servings of fruit and vegetables that people were consuming every day, from 0 to 1 up to more than 7. And you can see that from all-cause mortality was reduced up to 42% in people eating up to 7 servings of fruit and vegetables a day. If we look specifically at heart disease, there was a 31% reduction in mortality. In cancer, I'd point that out a little bit, about 25% reduction. So even if people were to eat 3 to 5 servings a day, there's a significant reduction in all of those parameters. There was a Finnish study that looked much smaller. That one was about 60,000. This is about 5,000. Once again, you can see that the relative risk for coronary disease death between the highest fruit and vegetable intake and the lowest quartile, you reduce the risk by 25-35% there. And I won't go through all these statistics, but these are other studies, the large cohort trials, the Framingham Heart Study, the Women's Health Study, Nurses Health Study, health professional studies, where they looked at these large cohorts of patients that in all of them they found that consistently there was a much lower risk of cardiovascular disease and those that consume more fruits and vegetables. So I think there's a clear message there that eating more of those is better for you. And I thought this was a helpful chart just to visualize. This is a list of some of the studies I mentioned, and almost all of these things show a relative risk in favor of eating more fruits and vegetables, with hardly any of them actually crossing this line, meaning that there's no question that there's some benefit in consuming fruit and vegetables. So that's something that we really need to encourage, and I really try to encourage my patients, is not only cutting back on some of the bad stuff, the refined stuff, the fats, but eat more color, eat greens, eat yellows, eat oranges. You get a lot of things, of micronutrients, the phytochemicals, the fiber that we just can't reproduce in a pill. And interesting, I just wanted to point out from some of those studies, this is from the Women's Health Study, or the Nurses Health Study in particular, and the Health Professionals Follow-Up Study. They found that in particular green leafy vegetables are very good, probably the best at reducing the risk of coronary disease, also very good at reducing risk of stroke, but citrus fruits were also very good. In fact, the best that they found in the study at reducing risk of stroke. So back to the nuts. I think there's always a lot of controversy about nuts, and as I mentioned, Dr. ESSELSTYN really didn't include them in his diet. We said in that Adventist health study there were definitely some documented benefits with up to 50% reduction. These contain essential omega-3 fatty acids, especially walnuts. They're also rich in arginine, which arginine is a precursor to the development of nitric oxide, which again is that substance produced by the vasculature, which helps to dilate the blood vessels. So there are some theoretical benefits there. They are found to have some antithrombotic effects, so where they prevent clotting, and antiarrhythmic effects. High in some other minerals there, magnesium, copper, folic acid. And we talked about the Adventist Health Study reducing, and here is where I mentioned consuming nuts more than 5 times a week versus less than 1 time a week. We could see about a 50% reduction in cardiovascular events, and that was when all other things were accounted for, so accounting for adjustments in age, sex, some of the other risk factors, smoking, hypertension, and similar findings in the Nurses Health Study. So consuming nuts in limited quantities is a good thing. Now, for a lot of our patients are overweight, and I make sure they measure them. Eat a quarter cup. You have to actually take out the measuring cup, because some of these people eat a lot more than that, and if this contributes to obesity, then that's going to cause some other problems. But I always say it's a good snack. They're filling, and they have some certain health benefits. The grains is always a controversial topic. I have a lot of patients, the first thing if I ask them what they're doing, if they're trying to lose weight, it's I cut out carbohydrates. And there are certainly, most of the carbohydrates we eat here are bad. There are a lot of refined carbohydrates, a lot of simple sugars that we consume. But there are also ones that are good, some of the whole grains, and there are a lot of those out there. So in the refining process, we move the outer bran and the germ, which has all the protein and the minerals, and what we end up with is something that has very little nutrition. The refined grains cause spikes in glucose and spikes in insulin. The whole grains, when you get the protein benefits, you get the nutrient benefits, and they're much more slowly digested, so you don't get these spikes in your blood glucose and blood and insulin as you do, which are really responsible for some of the negative effects that we see. And there are some specific subgroups that probably have some grain intolerance, but those are likely the minority. So when I try to talk to my patients about this, I promote consumption of whole grains, but again, you have to do this in smaller quantities. So the grains certainly carry, they're calorie dense, many of them, so you have to make sure they measure them. Measure a half a cup or measure a cup, not 6 cups. And this is, again, a chart similar to what we saw with the fruits and vegetables, where there is found to be a pretty consistently lower incidence, lower relative risk of cardiovascular disease in those that consume whole grains in the highest group versus the lowest group. All right, then finally we looked a little bit at dietary patterns. So there were some studies that looked, and this again goes back to that nurses' health study and health professionals' follow-up study. Ones we alluded to before, where they looked not just at specific foods, but a prudent diet or a plant-based diet versus a typical Western diet. And those that ate the most typical standard diet versus the most stringent plant-based diet, you could see the risk of coronary disease was reduced by 25% versus increased almost 50%. And then there were groups in between where they ate maybe what we would consider a typical American Heart Association diet. So we saw that in both studies where there was a significant increase in the typical Western diet group and a significant decrease in the most stringent plant-based group. So, and just to conclude, I have a couple slides on what are some of the adverse effects of animal protein other than just the fact that you're getting more of the saturated fat and cholesterol. One of the mechanisms out there is we produce more of a substance called ADMA. So this is naturally produced in our bodies from protein turnover from cell death, but we also get much larger amounts of this concentrations in our system when we consume a lot of protein. And the issue with this is it competes with arginine to form nitric oxide. So if you have no ADMA, you have arginine. This is metabolized by an enzyme to form nitric oxide. Now you have ADMA competing with arginine, and so there's not as much arginine turning into nitric oxide, and you get lower levels of nitric oxide. In addition, if those that consume a lot of animal protein have a lack of something called DDAH, and the DDAH helps to destroy this ADMA. So there are two mechanisms where we really lose nitric oxide, and these are mechanisms by which you can see a rapid change once you change your diet. So we saw that with that nuclear study, that this is a process that can be reversed very quickly rather than looking for actual disease regression of plaque. And I think we talked about this, all the beneficial effects that we see with nitric oxide. The main ones to keep in mind are vessel dilation, anti-inflammation, and reducing the platelet stickiness. So those are the three things I try to keep in mind. And then the other one that's been more recently described is something called TMAO, which is found to be, it's an atherogenic compound, so it really promotes atherosclerosis. It's produced by a bacteria in the gut, only in those that eat meat. So in vegetarians, this is not produced at all. But it's found to be a very high association with levels of this in the blood and progression of atherosclerosis. And they've also found that not only reducing some of the bad things that we eat, but increasing things like the green leafy vegetables, the other things I talked about, actually helps to regenerate some of the inner lining, make it more of a healthy inner lining of our blood vessels, which is going to be more efficient at producing nitric oxide. And when that damaged inner lining actually produces substances that cause the vessels to constrict, endothelium and something that causes those platelets to get sticky called thromboxane. So as we shift our diet, we have a newer layer of cells that produces the good stuff and produces less of the bad stuff. So in the last couple slides, I'm just going to mention what we always struggle to figure out ways to help patients transition from a typical standard diet, which they're so used to a more plant-based diet. And we have a number of programs in place in the Lee Memorial Health System. One of the ones that we started back in October or so was something called a JUMPSTART program. And this is really a 10-day program. And the idea originated from this Plant Pure Nation movie. I don't know if anyone saw that movie, where Nelson Campbell had people do a 10-day program and show them their before and after biometrics, so their weight, body mass index, their lipid levels. So we collect all these parameters before, we have all their lunches and dinners prepared for them, and then check all these same measures afterwards. And we've conducted 2 of the programs so far, and actually a 3rd one just finished, and we just started a 4th one. But the 2 that we did in the fall showed pretty impressive numbers where we saw just in 10 days reduction in body mass index. We saw a reduction in the LDL with this first group by over 20%. HDL was reduced slightly, and total cholesterol, you can see, was down by 15%. And the second group also had a reduction in LDL, not quite as robust, but 11%. So it's impressive to see just in that 10 days that we are seeing changes in the body mass index, changes in the bad cholesterol levels. And if we were to really look further at with the composition of the bad cholesterol, we're likely going to see, and we may do this, where we see there are bad forms of the bad cholesterol and better forms of the bad cholesterol, where we probably will see more of the better forms, the less atherogenic forms of that bad cholesterol, the LDL. So this is a project that we have ongoing, and we're going to try to collect some more statistics. And that is the end. So this was a quote by Michael Pollan, who's another an author that does a lot of stories and has written books on food. So I liked his: eat food, not too much, and mostly plants. And that's, I think, a good message, a good simple message to pass on to our patients. So.